I'm Corey Arena, and my clinical nursing problem is childhood obesity. The background and significance of childhood obesity is extremely important in the healthcare world today. The past 25 years, childhood obesity incidences have risen exponentially, and specifically in 2012, more than one-third of children and adolescents combined were considered overweight or obese. There are several health effects of obesity, especially in children, and these include immediate, that are high cholesterol and blood pressure, prediabetes, bone and joint problems, and sleep apnea. Long-term health effects include, but are not limited to, heart disease, osteoarthritis, stroke, diabetes mellitus type 2, cancer, and several other health effects. It is imperative for healthcare professionals, especially nurse practitioners, that are in the front line of preventative care to address these issues to hopefully decrease the incidence of childhood obesity. There were several research studies used within my original report, and a few are mentioned here. One qualitative and 6 quantitative studies were used in the report. Some significant findings included that children are more likely to be obese if their parents are obese. If one parent is obese, there is a 50% chance of their child becoming obese. If both parents are obese, there is an 80% chance of their child becoming obese. We also found that concerned parents are more likely to limit screen time, increase physical activity, and improve diet more than non-concerned parents. So it is important for healthcare professionals to address the risks and likelihood of their child being obese because concerned parents make better choices. Another point found was that educating parents on obesity risk directly impacts healthier food choices for their children. And the last point made was that children with families where both parents are obese were 6 times more likely to be unsuccessful in weight loss management than children whose families did not have obese parents. So I decided to do an educational PowerPoint to nurses in the University of Kentucky Hospital. My purpose was to improve education of hospitalized children and families by providing appropriate obesity education to nurses in the Pediatric Progressive Care Unit at the University of Kentucky. This target population was chosen because these nurses provide care to overweight patients daily. Many of these patients suffer short and long-term health effects of childhood obesity. It is important for nurses to be aware of the effects of childhood obesity. The project was implemented through an educational tool. This was a PowerPoint that was created that covered a few things, including negative health effects of childhood obesity, risks of childhood obesity, and the importance of teaching families about obesity. There were flyers posted in the unit with information on how to participate in the education offered, and on July 13th, 9 PPCU nurses were included in a discussion about education offered and how to improve teaching for families about obesity. This discussion was extensive, and we talked about many things about childhood obesity and the past experiences nurses had, and the evaluation showed that 9 out of 9 nurses believed that the education was helpful. There were a couple important feedback points about the presentation, and one of them was that nurses feel uncomfortable about speaking to families about obesity. An easy way we found to address these issues was to just consult our pediatric dietitian on admission when the nurse sees that their BMI is greater than 25. Another feedback point found was that nurses don't know how to address obesity issues without coming across abrasive, and healthy dialogue we found could be created to appropriately speak with families about weight issues. Some strengths noted was that there was positive feedback and discussion from nursing staff as well as our pediatric dietitian and nurse manager. Some changes that could be implemented would be increased time to collaborate with members of the healthcare team, and then forming better tools for proper communication between families and RNs. It is extremely important for healthcare individuals to understand how parents greatly influence obesity and to identify risk factors to create programs and treatment plans for families to decrease these incidences.